welcome to this month's webinar from the Zimbabwe Digital Health Society. Maybe as more people are just signing in, a bit of introduction on the Zimbabwe Digital Health Society. What we are is a community of practice. So essentially, that's everyone who's involved in the digital health space in Zimbabwe. What we're saying is let's all come together and have a forum where we share our insights, our learnings, so that together we can then advance the digital transformation of healthcare in Zimbabwe. So some of these sessions that we're doing, it's then to really build that fellowship, build that association, to avoid duplication of efforts, which is something that has always plagued digital health, where we have many people doing very various things. Sometimes it's actually the same thing, and then you get one pilot coming doing this service, and then in exactly the same area, same kind of application, someone also comes, and then they try that, and then what we're doing is repeating the same thing and failing to get learnings from past lessons. So we then always get stuck in the same spot. So it's always good to get to know each other, to get to understand what's happening, and through that we then can share insights. We then can push collectively for changes, whether it's policy, regulatory changes, or even just engage with the powers that be in the ministry. I'm aware that through the ministry, the WHO has increased its efforts to try and understand what's happening on the ground in Zimbabwe in relation to digital health. There was a digital health atlas which was launched many years ago, but then it's an underutilized resource. So the digital health atlas is a website run by the WHO, where you can then kind of go through each country and then see the digital health investments that are being made, or the projects that are being run in that country. So for a long time, there was very little information on Zimbabwe, or some of the applications there would be things that are not really working on the ground. So they've reached out to entrepreneurs, to organizations, so that they then can make their entries there, to then make it at least a very useful directory where people can then go. So essentially, it's a digital health observatory for people to understand what's going on. So yeah, that just shows the importance of what we're doing here as the Digital Health Society. We have had, this is like our fourth session, so if you would want to catch up on what we've been discussing in the past, please go to our LinkedIn page. You find us there on LinkedIn, and then you can get links to the past talks that we've done. We've had talks on the whole digital health landscape of Zimbabwe as well as neighboring countries. We've looked at the Impilo National Electronic Health Record, the project, and then how maybe it applies to us as people working in the private sector. We've discussed about AI, learning about how AI is being used, and getting practical examples and insights from people that actually are doing it in Zimbabwe as well as the African context. And so now today we're going to be discussing about telemedicine, particularly the business of telemedicine. It's kind of good to see how the whole area has grown over the years. In the beginning, when I got into this back in 2013-14, the first thing would be mainly to try and help people understand what telemedicine is. So, we dwell on definitions of telemedicine, and then back then we'll then cite what other countries are doing. Other countries in terms of Western countries or in the developed world. Then as time progressed, we'll then cite examples of what is being done in South Africa or being done in Kenya, Uganda, Tanzania, things that were happening around us. And then a couple of years later, we'll then get to cite examples of things that are actually being done in Zimbabwe by locals. So it just shows the progression that we've gone through, and now the number of players has increased, particularly after COVID. I remember before COVID, a boss of mine, one former boss of mine, I always say this story quite a lot. He once kind of shouted at me and said, Marlon, you are wasting my time with this telemedicine thing. This is futuristic. It's 7 years from now. But then there was just COVID around the corner. And then when COVID happened, then everyone was kind of now using telemedicine. And even people on this call, I would like to thank many people on this call, even listening in, particularly in Zimbabwe, have used telemedicine because if you have used WhatsApp to ask for medical advice or to contact your pharmacy or your doctor, your GP, that is a form of telemedicine where essentially it is just using ICT to connect the doctor and the patient, overcoming the distance barrier and delivering healthcare, whether it's a prescription, whether it is advice, anything that leads to health outcomes being delivered via technology. That's what telemedicine is. So it's happening quite a lot, and we've now seen a couple of years ago the regulator, the Medical and Dental Practitioners Council, actually come up with a set policy or a guideline to help practitioners on how to do telemedicine, which was a big step because it then kind of made it clear that telemedicine is something that is allowed in Zimbabwe. Before that policy, people would be 50-50, not knowing whether it's allowed or not. But when that guideline came out, it was kind of say it's almost a green light, but it was also responding to the growth of telemedicine, them seeing people using various platforms, various companies coming up, and it was then time that they tried to organize and have a communique on this. So we also saw the regulators in South Africa, they had to update their telemedicine guidelines, particularly after COVID, when the number of players then increased. So in Zim, we're also seeing the number of players increase, the number of entities that are investing in this space that's increasing, because essentially, I think where we're going, telemedicine will just then become a part of healthcare. It won't have these fancy terms. So that's where we're going, and so we're excited to then have people on the ground, representatives of organizations that are actually doing telemedicine, to come and then take things a step further, which is actually to look at the operations, the profitability and sustainability of telemedicine, going beyond the basics of what is telemedicine, what is the potential, what is the what is the potential of doing that, how it can increase access and so forth. But now it's now actually to have it implemented on the ground and to run it in a way that is sustainable or profitable. So we are honored to have representatives from three startups or organizations that are involved in telemedicine. We have Dr. Tongona Midzi, who is representing Azanza Health. We have Dr. Tavuma Parenyatwa, I think founder and CEO of Health at Home. And then we have Mr. Tawanda Njerere, who is representing ZimSmart Villages. So I think we do have them on the call. What we'll do, gents, is we'll first kind of allow these companies to just introduce themselves and what they do in a bit, and then we'll then get to dive deeper into questions where we are examining those kind of three areas: operations, profitability, and sustainability. So maybe let me start with Tawanda. Tawanda, if you may, please introduce yourself and introduce ZimSmart Villages in a bit for those that might not be aware. Over to you, Tawanda. If we lost Tawanda, Tawanda said he was in Nyanga, so you might have dropped off. All right. Dr. Tongonamidzi, if I may come to you whilst maybe Tawanda logs back in. If you may just introduce yourself and what Azanza Telehealth, what you guys do. Dr. Tongonamidzi, you're on mute. All right. Let's try Dr. Tafuma Parenyatwa whilst maybe these guys are signing in. So, Doc, over to you if you may introduce yourself and Health at Home to give people an idea of what you guys do.
Good afternoon. Can you guys hear me?
Yes. Yes, thanks.
Okay. Yeah, well, thank you for the invitation. And just as a small introduction of Health at Home. Health at Home obviously started as myself doing home visits. It started pre-COVID, and I was just driving around doing home visits where I was called. However, when COVID hit and I realized that I was spending more time in traffic as compared to actually seeing patients, I decided to get other doctors on board who were located in different areas, and we kind of had a network of different doctors who could service different areas. And then that just mushroomed from doctors, and then we got specialists on board, got nurses on board, got physiotherapists. So it's a one-stop health shop. And yes, it's still running today.
That's great, and really quite happy to have you here because what you guys are doing, you're representing the next phase or the transition of healthcare delivery, which is moving from the hospital to home, and that's one of the things that telemedicine allows, that you can then get care at home, and we've seen in the UK, the government, they're actually making a big shift. That one of the things that they're aiming for is to try and move all care to do it at home. Because then that reduces costs and reduces maybe improves quality. So what you guys are doing, you actually kind of taking us there to where healthcare is going. So I will get back to you in a bit. Tawanda, I see you're back. If you may please just briefly introduce yourself and then ZimSmart Villages, what you guys do.
Thank you, Marlon. Sorry for that break in connection earlier on. My name is Tawanda Njerere. I'm the one in charge of operations for a social enterprise called ZimSmart Villages, currently operating here in Zimbabwe. What we have established as ZimSmart Villages is a hybrid model that combines, of course, the application that we use called Bati Health and the human touch, using nurses in remote areas. So what we have done is that beyond the app that we have established, we realized that because most of Zimbabwe's population is in underserved communities, over 60%.
You just went on mute, Tawanda.
Okay, sorry.
Okay.
So we realized that over 60% of our population here in Zimbabwe is living in underserved communities or remote or rural communities where access to a smartphone or access to internet technology is most of the time a challenge. So we went on to partner with the Zimbabwe Postal Services, where we then started establishing what we are calling telehealth kiosks within post offices, whereby if one is to access such a facility, they've got access to a virtual consultation with a medical practitioner, with a doctor. They've access to point of care diagnostics. They also have access to medicines which they can collect at the point of care. Then in areas where we do not have post offices, we have also set up what we're calling telehealth booths or kiosks, which are standalone in sites that we have picked. So these kiosks are meant by a registered nurse who then facilitates the consultation between the client or a patient with the doctor who is available virtually. So to date, we've set up 25 sites and we are further decentralizing this model using what we are calling digital health promoters who are going out into the communities, encouraging and teaching community members about accessing this kind of service. Thank you very much, Marlon.
Thanks so much, Tawanda, for that, and it's exciting to see what you guys are doing. We kind of already had Dr. Admojo Quiro. We hosted him here on one of our sessions, and yeah, it's impressive what you guys are doing, and we're rooting for you. And then I'm sure we're going to get to discuss more about how it is you're doing it, how you're finding things. Then over to Dr. Tongona Midzi. He expressed he's at Paranyatwa, and there's some internet challenges, but hopefully, yeah, he's back and he can hear us. So, Doc, over to you if you can introduce yourself, and then what you guys do at Azanza.
Hello, hi, good afternoon. Thank you very much, Marlon. Sorry about that hiccup in network earlier on. My name is Dr. Tongona Midzi. Currently, I'm the operations manager at Azanza Health. So Azanza Telehealth is a startup initiative that is prioritizing essentially to democratize and sort of decentralize health imaging. The accessibility to imaging services is very limited all over the country. So the idea of Azanza is to try and decentralize also the personnel that we have in the country to report to the specialists to see are not able to be everywhere every time. So the idea is to decentralize, sort of have people in those outskirts, have people who can take images and everything, and then we have a software, a cloud that uploads all these images, and you have a specialist sonographer, a physician, a cardiologist, who then looks at these images at the end of the day, give a report, so that basic medical imaging is accessible to everyone. So that's essentially the vision. Currently, we are also expanding into Harare polyclinics as well, so that maternal imaging doesn't become difficult or is not expensive essentially for mothers. It's something that they can also access and have all the maternal scans that they need during the pregnancy as quickly as possible as well. Thank you.
Thank you very much, Doc, and a great initiative that you have there. It definitely is something that is a need, being able to decentralize access to imaging services. So that's great. Now, let's jump into maybe the first area. It's operations, and it's great that we kind of have people that have operations as part of their titles already on the core. We have kind of experienced it already during this webinar. The internet challenges. Of course, Tawanda, you are out there in Nyanga, but Dr. Dr. Tongona is at Paranyatwa Hospital. So internet challenges, the ups and downs of the service, and particularly if we're going to rely on technology to be able to deliver healthcare for all that you do. Maybe let's get some insights into that. How it is that you are managing to get your operations running for you to actually deliver your services via technology. So, if I may start with Tawanda, if you may share some insights on how you are overcoming this operational challenge or dealing with it.
Okay, thanks very much, Marlon. So, when I lost communication, I was just switching over from mobile network because we just got to a site where we are doing some stakeholder interactions, and I switched to Starlink, where I'm now connected. So I think that experience is a good starting point for the question that you just asked. So I would want to admit that unfortunately, when we started off right with our first kiosks, I think before the the acceptance and the legal affirmation that was then given to Starlink, we used to have a lot of these up and down challenges within our ecosystem. But I'm happy to say that with the coming in of Starlink technology, it has really brought reliability to the kind of work that we are doing. The other thing that also comes with Starlink with the internet or the connectivity challenge is the power challenge. So in the communities that we are currently working, we realized that when we started, we used to rely on ZESA, and ZESA would in turn also then downstream impact connectivity. So we then went on to a model whereby we are using solar is the main source of power. Then we have what we joke around and say ZESA backup, because we then use ZESA for our rechargeable or our storage or for our UPS systems to then recharge whenever ZESA is available or whenever we have access to adequate solar recharging. So really, back to back, we have really had to have connectivity, reliable connectivity, and at this point, reliable connectivity, we have only experienced it with the coming in of Starlink technology at the site within the community. So we then have Starlink connectivity within the community, and we also need to ensure that we have Starlink connectivity where the practitioners are sitting. We have had ups and downs at times where maybe the practitioner has no access to Starlink connectivity and they need to use other sources for connectivity. Then we have had to resort sometimes to WhatsApp calling, sometimes to actual calls, but then that defeats a lot of things in terms of what we are trying to achieve with the system that we are using, Batsi Health. But I would want to say that the coming in of Starlink has really been a game changer in terms of how we have tackled this issue to the point that even as we are further decentralizing our model using these digital health promoters, we are also empowering them with a Starlink kit so that they are able to take the same kit into the community. And you'd find that where we have placed the kit, some of our standalone kiosks at schools, the kit has then had multiple impacts besides the health, because the students have also had the opportunity to access, the connectivity, the teachers, even some of the issues that we dispatch in terms of health education. We now have, a good conduit with communities to achieve this. So basically, Marlon, I think this is how we have gone around it, and I think the coming in of Starlink was really timely. Thank you very much.
Yeah, thanks so much for those insights. Indeed, this form of satellite internet really opens up the field. Maybe going to you, Dr. Midzi, from my understanding with imaging, you guys would need a specialized kind of device to be able to then take your cardiogram and then transmit it. How are you handling that operations aspect of bringing in devices as well as then connecting them to the internet? How are you guys figuring it out?
All right. Thank you, Malon. So we use very, very simple devices. So our imaging screen is usually an iPad or an iPhone, whichever is available at the time. So all you need in the iPad or the iPhone is an application called the Butterfly application for sonography. However, you do need a probe, and these probes are mainly, maybe not mainly, but majority you will have to import them from the United States. So the cost there is a bit hefty and also duty and everything. But the beauty of the probe and the iPad is that you don't necessarily need an internet connection whilst you're doing the scan. So you can go to Mberengwa, do your scan, and when you have access to internet, you can always upload. So and that makes it easier for us in situations where network is an issue or Wi-Fi and connectivity is a problem. We can then have just one base station where we can collect all the images that we need in that particular day. Then at the end of the day, we upload all of them, and then they are put into a cloud. Um, However, in terms of our electrocardiogram, we use a device called a smart heart. So a smart heart is it's a small device that can be used. I mean, you can even speak to a vendor, just show them how to do it, and it's very easy to utilize. However, a smart card needs connectivity for it to connect to the cloud because as soon as the ECG is done, it has to upload automatically into the cloud. So that is where we have had a bit of issue in terms of Wi-Fi connectivity, but again, these smart cards are also largely more accessible from the United States as well. So we sort of face this similar problems with getting the butterflies. However, we to try and mitigate that smart card issue, we've used just simple MiFis to walk around with that make connectivity quite easy, and we're able to access everything. So the smart card also can work with your mobile phone, an iPad, or even a computer. All you need is an application. So in terms of devices that we can sort of use, you can use the same device for the ECG. You can also use the same iPad for the scanning as well.
Yeah, so many things that you raised there. The store and forward functionality that using that this thing it takes the image and then once it gets online it then forwards it. It's one strategy that has been used in several places to overcome the challenges and still deliver telemedicine. So that's great. But you mentioned that you have to pay import duty for some of the devices that you're bringing in. Isn't it that health devices in Zimbabwe are supposed to be exempt from duty? Or yeah, if you can quickly just speak on that.
I mean, like, so we started in 2020. That was not the same at that particular time. So it was just one of the challenges that we had to face. But now we've had all the devices that we had sort of acquired them earlier on. We haven't had to face such an issue currently. Yeah.
All right, all right. Thanks, Doc. Then, if I may come to you, Dr. Parry, with your service, this requires people getting onto your website and then arranging for the doctor to then or the nurse to then come and take care of them. How are you finding operations there in terms of the members of the public finding it easy to use the website, as well as then even getting to coordinate your doctors to then respond and be on that tech? If you may speak a bit on how you are achieving operations.
Yes, so thank you for the question. Initially, we tried to encourage all visits to be booked on the website, on the mobile application. But we found health is something very personal. So people don't want to book into a machine; they want to book into a person. So we had to shift away from that and have a call center. So all our bookings are made via our call center. It's just people are not used to booking for the doctor on a website because you're not sure if the appointment is. So for now, the mindset is still I need to call the health at home call center for the booking to be confirmed, and then the logistics are sorted out via the call center.
That's great insights there. Another lesson there. When you devise your app, you design your technology, everything works so well. But then it is when you actually then apply it and you put it to market, that's when you then realize that you need to pivot, you need to adjust, and then you get insights. The famous quote from Mike Tyson: "Everyone has a plan until they get punched in the mouth." So that's great there. Then call center operations. Yeah, that's another headache. When I was at Econet, we would run the dial doc service. So that's a call center again kind of service. And then yeah, so some operations about getting people to be there on time and pick up calls, and then how are you handling that? Working with doctors and ensuring then that or that there's always someone there to pick up. How are you handling? How are you keeping your operation, your call center operational?
Yes, so it's logistically it's actually not a nightmare because
Mhm.
we have two call center lines, each
Mhm.
with permanent cell phone numbers. So the call
Mhm.
center will be answered almost instantly, and
Mhm.
then it's up to the call center operator to liaise with the available doctor at the most appropriate time, and then get back to the patient to confirm the booking. So it's not as challenging as you may think, because
Mhm.
after years of functioning, the people at the call center know that Dr. Marlin works at X clinic. His schedule is pretty much like this. He
Mhm.
lives in this area. So when you get a phone call, it's easy for them to tie up a doctor
Mhm.
with a visit, just because
Mhm.
they know where the doctor lives, they know where the doctor works, they generally
Mhm.
know the doctor's working hours, and then you kind of try and match doctor to patient like that.
Mhm. Yeah, but exciting stuff. It's kind of like speaking more to some dispatch technology that, but yeah, great stuff. So let's maybe try to progress on to the aspect of profitability. I'm not going to ask you guys to share your financial statements with us. No, that's not the focus, but is to try and get insights from you on how you are approaching this. What lessons you have learned in terms of making your business more profitable, or even actually talking about what you think is needed for you guys to be more profitable, whether it is in terms of regulation or in terms of something that needs to be done in the market. It's just getting insights from you on how you're doing it, or as well as what you think is required for you to to enhance profitability. So if I may go back to you, Town, and start with you on that question.
Okay, thank you very much, Marlon. So we have had to go to communities to interact with them so that we also understand the pain points that they are currently facing. So what we have done, of course, we know that the core business that we are there in the community to implement or to deliver is healthcare. But we have not thought of healthcare in isolation. So we have taken a pain point kind of approach to our model. When we today, as we are structured, we, apart from offering telehealth, we now also have the opportunity to run medical outreaches, which include eye care camps, which include scans, and I'm happy that Azanza Health, who are one of our partners, are on this call. So we have had to do outreaches where we have used some of their technology to address some of the pain points within the communities. We have also ventured into what we call e-commerce, where these sites where we have opened, and they're not necessarily post office, they're standalone. They've also been given sub post office status, which means that they can receive or send packages with us earning a commission on that. In 2026, we'll be ramping up to ensure that within the same kiosk, you perhaps be able to also access your Zinara, you'll be able to access your vehicle insurance, because these sites will also be, sub post office or e-commerce centers. So we are structuring ourselves as a complete or a holistic community hub, which of course improves on health, which also impacts or improves on economic well-being, because these two are intertwined and they both affect each other. So in terms of how we have been running, I'm sure it's all public knowledge that our consultations, some of our consultation fees as low as $5. But when we look at our value proposition to the client, our client who is mostly in rural markets, we are not really looking at $5 as an amount, but we are saying that the $5 is an amount that is going to save a family's full days of travel, and perhaps over $50 in costs. So we are basically unlocking value for these communities. Yesterday, we were in one community in Nyanga South, under Chief Tangwena. And we heard that at times in the evening, if someone requires medical attention or outside the normal times for transportation for people to get into Nanga, because the transportation either moves early in the morning or end of day, people can pay as high as $100 over a distance that is less than 60 kilometers, if it is regarded an emergency for them to get transportation to take them to see a health practitioner. So these are the things that are now then really demonstrating that we are unlocking value for the communities that we serve, and in turn we then get individuals coming through and they understand the value of the $5 consultation. So for us, making telemedicine truly profitable and scalable, we have realized that we must think beyond the patient fees. We need to think around diversified revenue models, which include partnerships with other entities. For example, on the community health days, we partner with other entities that we go into the community with. Some of the standalone kiosks that I'm talking about, we have actually built them through such kind of partnerships. We've also started working with insurance companies. We have had so far 4 that have come strongly on board, that have allowed us to consult their members in those remote communities. One of them is the one that is the main insurer for the civil service, because they've not paid money to Marlon. I'm not going to mention them by name, but these are some of the partners that we have partnered with in terms of delivering care. Then we have also gone and diversified further into corporate wellness programs, whereby after corporate wellness programs, there are other patients that we've had to admit into the virtual hospital, whereby we are managing patients with chronic conditions, and these patients get to pay on a monthly basis for the services that they get through our doctors and nurses who are monitoring them in the virtual hospital. So these are some of the things that we are currently looking at, Marlon, in terms of what we are doing, but also what has driven the, maybe I would now be jumping into another area, but there's also the aspect of sustainability, where there are also ingredients to the sustainability of this kind of approach, where we, of course, we have relied on the alignment with, government policies, alignment with what tech companies are trying to achieve in terms of innovation, but most importantly, is us trying to build community trust. Because once you do not have the community trust, even if you have to charge $1, even if you have to charge nothing, this kind of service, because of its nature, because it's new, the communities can shun it. So really, this is how we have gone around the issue of profitability, which cannot really could be, divorced from the issue of sustainability. Thank you very much.
No, thanks so much, Tawanda. Things that you raised there, diversifying revenue streams, and it's something that has to be done because technology is pluripotential, and then once you have brought in internet access there, you might as well then bring in everything else. Maybe to Dr. Midzi, let me pose this question in this way regarding what you guys are doing. What do you think is needed to help you in terms of becoming more profitable in your business?
Okay, so I think regarding the vision that we have, the truly way to grow and to be profitable is to scale up, to decentralize as much as possible, to touch those communities that have no access. So as the previous speaker said about how the majority of Zimbabwe's population is in the rural areas. If you ask yourself how many ultrasound scans are being done in the rural areas, you'd find that they're very, very little. So I think for us, scaling up and also just decentralizing as much as possible, we've already embarked on the local clinics that we have here in Harare, but really the vision is to move to Mutare, to move to Mberengwa, to move so that the more people that we empower to be able to do this, and it will also bring more revenue to us and more profitability, and also diversifying streams of income. We also have embarked on a journey of occupational health, where we assist companies in doing their yearly medicals, because most of our equipment is mobile. It's very easy for us to travel to Kariba and just see 100 people all at once, as opposed to having them come to Harare and everything. So that has also been a boost for in terms of profitability, because we have also had partnerships with those companies in mind as well.
Thanks very much, Doc. Asking maybe Dr. Pari this question, but maybe let me put it this way. For business to be able to be profitable, you need to be able to to get to the market and get them to get the market to be aware of the service that you're offering, and that essentially is marketing, so that then people can then know you and then and acquire the service. How are you seeing this issue of marketing of health-related services? How are you handling that? Do you see that as an impediment to profitability, or you guys are figuring out a way around it in terms of promoting what you guys are doing and getting the public to know about it, so that you get to serve a lot more people? How do you? What are your thoughts around marketing?
I think the biggest marketing tool is to have a good service and make your patients and their relatives your brand ambassadors, people that go around talking about you. we service a lot of clients patients who have families in the diaspora, and these families are able to pay for their loved ones to receive medical care here locally. So once you've helped, someone's mother who's in the UK, she's going to put it on her group to say there's this service, this doctor, and it kind of just grows organically. So initially we thought we needed to go out and shout and scream in people's faces to say we exist, which yes, would still be fantastic. But I think providing a good service is a form of marketing in itself, because people will talk in rooms that you're not even present, talk about you and you're not even there.
Yeah, indeed, Doc, and that's great. Because of the current it's because of the restrictions, as well as I think ethically as well.
Correct.
Yeah, you would sometimes it can be quite harmful if that's professional services are marketed the same way as people market a beverage. So there's need for, and the best way then is for like you said, deliver a good service, and then word goes round. Now just Tawanda already mentioned on things regarding sustainability. Whilst I'm still with you, Dr. Pari, sustainability talks about this, is essentially about saying, will this kind of service be there in the years to come? Is it something that is just a fad? When we had COVID, a lot of people made money from testing, from COVID tests, but then once regulations changed, all that money kind of vaporized. How are you viewing your kind of service and your business, the growth? What investments are you making towards sustainability and growth?
I think you mentioned it earlier that healthcare is important, and the global trend now is to reduce hospital stay time in hospital. So that's exactly what we're offering. We're just offering a network where people can, a platform where people can come and, as compared to being admitted for 5 days, you're admitted overnight, and then someone from the Health at Home team can come and service you. So yes, I think it is very, very sustainable, because it's cheaper to go that route. If you're still delivering a good service at home, you also end up saving a lot of money. So we are in advanced talks with several medical aids. There's, once it's a new idea, there's always lots of skepticism, although people see the idea. So these things take time, and it's a process. I think everyone here has been part of or is part of a startup, and you understand the challenges and frustrations we face as new businesses.
Yeah. So definitely that's the trajectory. I think that's where more and more health is going to be delivered at home, and it's just then going through these growing pains and getting people to catch up with the vision. But certainly it's going that direction. Maybe in the time that's remaining, let's see questions from other people on the call. Please feel free to raise your hand, and then you can unmute your mic and ask your question to any of the panelists. I already see a question in the chat from Dr. Madziwa. He's asking if you've also tried CAD, so that's computer-aided diagnostics for chest X-ray radiography. I guess that question will be going towards you, Dr. Midzi.
Hello. Yeah, thank you for that question. That's really something that we're looking into, but currently we have had radiologists on board who are reporting our X-rays as they come in. So we haven't had the pressure to sort of move into that direction, but where we're going and also having the vision to decentralize and do more outside. One person will not be able to read 50 X-rays or 100 X-rays in a day. So eventually we're going to go there, but definitely that's the direction that we're going towards.
Thank you very much. If there's anyone else on the call who would like to ask a question, you can raise your hand unmute and and fire away. I see Dr. Matsiwa expresses his thanks regarding So maybe to you, Dr. Midzi, are you saying that you need? There's a hand that's up. Yes, Dr. Ngwarumno Mdodawafa, please go ahead.
Thank you, Dr. Nyakabau, for the meeting and coordinating and just leading the discussion. I think I've got a question for Azanza Health. Do you feel like maybe in terms of you having the images in the cloud and maybe easily accessible, do you think that might be some sort of business advantage for you in the market? Because I remember it's very difficult to get records for patients and even worse for imaging. Do you think that could be a business advantage for you that you have the records for the patients and might be easily accessible? And maybe you might offer that as a differentiation point with other services. Thank you.
All right. No, thank you. Thank you for that question. Yes, we've seen that as a huge advantage. So what it allows us to do is that most people will come for repeat imaging, right? So progression of a disease. Let's say someone came with dilated cardiomyopathy, they then started on medication, and 2 years later they come for a repeat scan. If they come to our institution for the first one and the second one, we're able to easily compare images from the previous. So it enhances just the quality of the report that comes, because we already have the previous and now we have the current, and it can help us. And having patients being patients or clients being clients, sometimes people lose their results. We have a cloud that will have your images and also your report. So right now we have images from 2021, for our patients. And if we're ever going to go into a research route, I think having that cloud and having that access to information and data would be very, very helpful.
Yeah, and I'll just quickly jump in to say that's also another solution to the profitability problem, or a way of diversifying your revenue. Because in terms of what was asked before, computer-aided diagnostics and artificial intelligence, one of the challenges that we have in the African context is lack of data to train our algorithms. So I've been involved in a couple of imaging AI projects, and the challenge would be your data sets will be coming from Europe, will be coming from America, and they are not suited for our context. And we even encountered a company in Nigeria that would actually then go around and fetch data sets for you. That if you're looking for particular images of this kind, they'll then go around and put that data set together. So you guys already having some data that you've accrued over the years, that it's very valuable. It's very valuable with where we are going with AI and training our algorithms, so that we get the ones that have less bias, that appeal to our conditions. So it's said that some facilities that have been in the business of imaging for years, they hopefully they don't delete their images, but I was told by some that you might be surprised that it's actually not being stored in that manner. So we're losing quite some valuable resources. Anyone with a question? I see we're at the top of the hour already. Maybe just if there's one more burning question.
Yeah, I have.
Go ahead.
So I was going to ask if there's a platform besides these sessions where like-minded people like us can discuss visions, way forward. The reason why I'm asking is, for example, I have a background in data science, currently working as a data scientist in the NHS, So I left the clinical aspect in Zimbabwe. But when I did come back to Zimbabwe 2 years ago, I faced some challenges in terms of, making a startup which is data focused. One of the challenges that I faced was, our practitioners or fellow colleagues are not yet, digitalizing or recording information, patient details, for example, in cloud, or even their own servers, for example. So it makes it's a challenge when it comes to, someone with my skill set and trying to to build a startup from scratch. So I guess where I'm coming from with this question is, if there is a platform like that, I think in the future it will make collaborations easy, because I'm already, for example, looking at how can I still impact, how can I provide or improve healthcare service, even though I'm now working in the UK. How can I go back and have that impact? So maybe the platform will help in terms of collaborating with other people on this platform and try to build something, because as like you mentioned, there are, some of those scans are now being stored in cloud that will enable partnerships to actually happen with people focused on telehealth, and then maybe other people coming in as data scientists and training those AI models.
Thanks very much, Doc, for that. So really, the platform in Zimbabwe is the Zimbabwe Digital Health Society. We have started off with these webinars, but I think going into next year, we're going to do a lot more things on the ground. There would be small forums, whether it's maybe a session at the Zima Annual Congress, or when we would organize the Digital Health Expo, or symposium, actually, Digital Health Symposium under the Zima banner. But that would be an event that happens once in the year. And so now, us coming together under this banner, the Digital Health Society, we then can be that platform. And the hope then is that we then bring in everyone that is needed, not just medical people, but everyone who's needed in this ecosystem to deliver. So that's people from the technical background, data scientists like yourselves, software engineers, and now we even have people with business background, people like Tawanda and so forth, to then come in and then really get to form this industry. So the platform, to my knowledge, is this one that we are collectively building together, so that we then can get to have more and more of those partnerships happening. And there is room. I think early on next year, we are going to be talking to, again, some Zimbabweans like yourselves who are doing some amazing things in the world, and then getting to share insights on what we could do back at home. So yeah, keep up to speed with the Digital Health Society. Follow us on LinkedIn, get up more updates, and then we'll build this together. Right. I think we might need to then bring this to an end. Allow me to thank our panelists, Tawanda and Jerere from ZimSmart Villages, Dr. Tongona Midzi from Azanza Health, and Dr. Tafuma Pari for their time. Parinyato from Health at Home. We want to thank you, gentlemen, for your time and sharing these insights that, if you pick up a document from the WHO on telemedicine, sometimes they just highlight success stories. But then the excitement is all around, saying, "Oh, look at how many people have been reached," but then Zimbabwe, being Zimbabwe, it's having its own peculiar challenges. We then need to hear from people that are doing it on the ground. so that we then get insights on how they are maneuvering around the various challenges, how it is that they're recognizing opportunities. And so we want to thank you, gentlemen. Thank you so much. And we'll keep up to speed. You can follow all these organizations on LinkedIn. You can find them. And in this, under this umbrella of the Digital Health Society, we'll continue to invite more and more startups to come and share their experiences. Also remember that you can find this recording on our LinkedIn page, as well as the other sessions that we've done in the past. So thank you everyone for your time. Wish you a good day, and yeah, let's keep on talking.
Thank you very much. Have a good day to you as well.
Thank you, Doc.
Thank
Thank you for
you.
organizing.
Thank you, Marlon.
Thank you.
Thank you all. Cheers.